are actually two combinations that has been just accepted, approved by the FDA recently. One is the combination of insulin glargine and lixisenatide, which is a GLP-1, or degludec, which is a basal insulin, and liraglutide. And so they were approved specifically. They were approved with a little bit difference in how you titrate. The degludec with liraglutide is once a week, the other is twice a week, but it doesn't matter. I mean, you can do it once a day, 1 unit, or 1 unit every week, or 2 units every week, as long as they do it systematically. And the other thing, which never made sense to me, is that we have given the GLP-1s on a fixed dose. Boom, this dose and so on. But this is a peptide. This is a hormone. And we just use that titrating slowly and gradually so that you use as you need and as you tolerate, like you would do with other peptides.
Been doing that with liraglutide for years.
Now, lixisenatide.
Yeah, but only 3 dosages.
Nope.
No, you can.
Nope, you got 10
This
clicks.
is your turn to say nope. He was saying nope before.
Ah, she's so tough.
No, maybe she's right.
Yeah, maybe.
But lixisenatide, but I'm glad you pronounced it first. The FDA was working on the approval, and there was a Get-Goal clinical program, right? What was that all about?
So the Get-Goal program was actually the combination of lixisenatide and glargine insulin.
Okay.
Lixisenatide itself is a GLP-1 receptor agonist. It's what we call a short-acting GLP-1 receptor agonist, which means that you take it within an hour of a meal. It works, it peaks around the time of the peak of the meal absorption, and then lasts for about 6 to 8 hours. And its advantage is that it has a profound effect on delaying the release of the nutrients into the intestine.
Okay.
So that the insulin secretion, which in type 2 diabetes is delayed and slow, has a better chance of matching that. So this short-acting, whether it's exenatide or it's lixisenatide, just flattens out the postprandial curve, much like, I mean, better than rapid-acting insulin. So it is a good medication for particularly addressing those people that have big postprandial spikes.
Does that make it a different drug from the other GLP-1 receptor antagonists?
Well, it's a difference because this is a short-acting. There are 2 short-acting, the exenatide and lixisenatide. Exenatide is given twice a day, lixisenatide is given once a day. Liraglutide is a much longer acting, and then you have dulaglutide and albiglutide that are once weekly. The one that are long-acting have some tachyphylaxis in terms of the effect on the gastric emptying. They don't have much of a gastric effect. They have a little bit of postprandial effect, predominantly have an effect on the fasting, and as the blood sugar comes down in the fasting, has a carryover effect throughout the day. Lixisenatide is short-acting, so you give it before breakfast, boom, they flatten the postprandial at breakfast, and has some carryover effect after lunch. Why after lunch? Maybe because since, as Carol said, no nutrient exposure to the beta cell, there's no insulin secretion, the beta cell probably gets recharged and acts after lunch and so on. So it's very specific in the postprandial effect.